Good afternoon, everybody. Thank you very much for joining this session to hear an update on the developments at Regeneus. Happy Diwali to all the Indian attendees, and I will start the presentation. So a brief overview of the company. So we are a Australian-based regenerative medicine company at the clinical stage, developing cell therapies for knee osteoarthritis and other indications. We had an annual revenue of over 7 million Australian dollars with a net profit of 2.8 million dollars in the last financial year, ending 30th of June. The company has a differentiated technology which combines mesenchymal stem cells and their bioactive secretome. The technology is protected by over 80 patents in key geographies. So we are a phase 2 ready company. Our Progenza asset has great preclinical and phase 1 data in Australia, and now we are preparing for phase 2 trials in the US and Japan, which are about to initiate later next year. The company signed a collaboration licensing deal in Japan with Kyocera Corporation, which entitles us to additional $30 million in milestone payments expected in the next 2 to 3 years, with additional royalties from the final product sale. Our market cap is around 22 million Australian dollars. The company is run by an experienced team of individuals. So our board is chaired by Rosickas, who is a representative from the Sherman Group. Other directors include Leo Lee, President and CEO of Novartis Japan, and the previous CEO of Regeneus. Also, Dr. John Chiplin, who's an experienced pharma and biotech executive. I came to Regeneus with over 17 years of experience in the healthcare sector. Our CSO is Professor Graham Vesey, who is an original co-founder of the company and is a key scientific driver for all our activities at Regeneus. And today I'm also joined by Dr. Charlotte Morgan and Dr. Sinead Blaber, responsible for R&D, CMC, and clinical development activities. And Charlotte and Sinead are with a Regeneus team already for a number of years. So a brief refresher on our technology and products. So Regeneus develops a technology which is a unique combination of mesenchymal stem cells, which are multipotent stem cells, having various functions in the human body, including reducing inflammation, secretion of bioactive molecules, and the potential for direct differentiation. And the second component of our technology is a bioactive secretome, which is a bioactive molecules, which includes cytokines, CDs, growth factors, and other molecules, which have an independent function to reduce inflammation and promote tissue repair, but also they improve functionality and viability of MSCs themselves. So, and this combination of MSCs and the bioactive secretome, we noticed that quite early on in the development process that it exerts a more powerful therapeutic effect than the MSCs alone would. We use allogeneic cells, so derived from a single donor, which enables us to scale the production process, reduce the cost of goods, and not rely on multiple donors to manufacture final product doses. We use adipose-derived cells, so the abundance and availability of MSCs in adipose tissue is much higher compared to other tissue sources such as bone marrow, thus reducing any variability issues which some of other companies are facing. MSCs are generally immune privileged cells, so they avoid the patient's immune system and therefore are considered very safe. We don't use any genetic modification, so basically this profile of our product is just considered relatively safe from the regulatory standpoint. And probably most importantly, quite early on in the development and also confirmed by our phase 1 results is that we can deliver a sustained pain relief with our Progenza therapy, so up to 12 months. And on top of that, we have early signals to believe that this therapy can also be disease modifying, so in knee osteoarthritis. So at this stage, there are no disease modifying therapeutics in knee osteoarthritis, and Progenza has an opportunity to be a first in class disease modifying therapy in this indication. So Progenza, which is a combination of MSCs and secretome, our lead indication is knee osteoarthritis, where I mentioned that we already entered into a collaboration and licensing agreement with Kyocera in Japan, and currently setting up a manufacturing process and preparing to launch a phase 2 trial. We are also actively preparing for a phase 2 trials in the US, and I'll provide a more detailed update in the subsequent slides, and are exploring other regions and indications for the Progenza platform. Our second platform is called Regeneus, which is a cell-free secretome. So we just take those bioactive molecules and add them to creams and gels for topical administration. So we explore various pain indications, and we recently announced a co-development deal with the Australian Department of Defense, and are preparing to launch preclinical and clinical studies for this product. A brief reminder on our preclinical and clinical data. So for Progenza osteoarthritis, we ran a phase 1 study in Australia where we demonstrated safety and tolerability of the product, but also secondary endpoints. We demonstrated certain efficacy endpoints such as pain reduction during the 12-month period, a statistically significant pain reduction compared to a placebo arm. And also we demonstrated that Progenza can potentially halt cartilage degeneration in knee osteoarthritis patients, or even potentially regenerate cartilage. In addition to Progenza phase 1 study in knee osteoarthritis, we recently ran a preclinical study in neuropathic pain by using a chronic construction injury model. And now we are exploring various opportunities of how to take this asset into the clinical development. For Regeneus, we had multiple studies over the past couple of years demonstrating safety and tolerability of a product, and also efficacy in certain indications such as acne or reduction in age spots. So we're currently exploring various opportunities to advance the development of Regeneus. Here I would like to provide an overview of the market opportunity we are pursuing with a focus on the Progenza and osteoarthritis. So pain is a large and growing problem worldwide. So over 1.5 billion people worldwide suffer from various types of pain. So lower back pain is one of the most prevalent conditions, followed by knee pain. And knee pain is essentially an inflammation and degeneration of knee cartilage, which causes discomfort and then pain, and this indication is just called knee osteoarthritis. So that's our key focus area for the Progenza going forward. When you look at the pathophysiology of knee osteoarthritis, so this is one of the most common joint abnormalities affecting humans. Osteoarthritis is an active and dynamic disease of the entire joint, and basically it is an imbalance between joint tissue repair and destruction, which causes the gradual degeneration of cartilage. And pain is a central clinical issue for patients. So typically how it is diagnosed is that patients experience low, medium, or high pain levels, and they get an X-ray, MRI scans, and the disease is diagnosed. So how does the continuum of treatment options in knee osteoarthritis look like? So at the low pain levels, typically patients are advised to lose weight, exercise more, have a physiotherapy. Generally, these interventions work, but the problem is that typically the adherence to these interventions are quite limited. And once the pain levels increase, there are oral solutions such as paracetamol or NSAIDs, but generally they provide only a very short-term pain relief and do not necessarily address the underlying causes of the disease. So at more advanced pain levels and just before the surgery, basically total knee arthroplasty, there was a category of treatments, interventional treatments, such as steroidal injections intraarticularly into the knee, or hyaluronic acid injections, and certain more experimental therapies such as nerve ablation, platelet-rich plasma, bone marrow aspiration, and others. But steroid injections and hyaluronic acid injections are most popular treatments. So generally, they provide a short-term pain relief, and again, does not address the underlying disease progression. So still cartilage continues to degenerate until the pain is so severe that patients need to undergo knee replacement surgery. So basically, this interventional treatments category is a real opportunity for Progenza to offer a sustained pain relief to patients, and on top of that, provide a disease-modifying solution to patients, where we basically either can stop cartilage degeneration or potentially regenerate cartilage. So knee osteoarthritis is a large health problem worldwide, over 240 million patients, 33 million patients in the US, which is approximately 1 in 7 adults. Japan is the second largest market with 25 million patients. So when you look only to interventional treatments, so injections, US is approximately 2.7 billion market size currently, and that's before the new treatments such as Progenza will come into the market, which will obviously grow the total market size for knee osteoarthritis treatments, and $1.5 billion in Japan. This indication has attractive characteristics as well from perspective of aging population and increasing prevalence of obesity. So older, more obese patients obviously experience higher levels of pain, and more of those adults experience pain in their knees, and thus growing the total addressable market for Regeneus and our Progenza product. And as I mentioned, still there are no disease-modifying treatments, and current treatments just provide short-term pain relief without solving the underlying causes of the disease. So how do we plan to capitalize on these opportunities with what we do at Regeneus? So there are basically 3 key value drivers for our company. So one is licensing and partnership deals. So as a clinical stage biopharma company, partnering with larger players, which might have either a experience in that particular indication or have a distribution network in select geographies, would be a value-adding opportunity for Regeneus. So we demonstrated that with Kyocera in Japan, where they have access to a wide network of orthopedic surgeons. So adding a Progenza cell therapy product to existing distribution network would enable us to reach the high market penetration levels quite early on in the commercialization journey. And we explored these type of opportunities in other geographies with a focus on the US market. So licensing Progenza in other geographies is a real opportunity for Regeneus, and we have an active business development pipeline and exploring these opportunities on the ongoing basis. In addition to licensing our technology, we are also preparing for an independent development of the Progenza and Regeneus products. So the US phase 2 trial of Progenza knee osteoarthritis, we are actively considering running that trial independently, and then consider licensing options after phase 2 readouts. We run various research partnerships to support our clinical development with the likes of Monash University, University of Adelaide, A-STAR in Singapore, and others. And the third potential value driver to the shareholders of Regeneus is a strategic M&A transaction. So whether merging with another company or selling the business to a larger player, whether it's a big pharma company, specialty pharma company, or a large biotech. So the company continues exploring various types of strategic M&A opportunities to leverage potential for synergies in driving the clinical development pipeline forward. So this slide provides a high-level overview of our clinical development programs. So basically here I would like to highlight three key programs we're running. So Progenza knee osteoarthritis in Japan, we signed a deal with Kyocera, where Kyocera is fully responsible for the funding for the development, regulatory, manufacturing, and commercialization of a product. The second program is Progenza knee osteoarthritis in the US. So we are actively preparing to launch a phase 2 trial next year. And the third program is Regeneus pain indications in Australia. And so these are three core programs, and I will go in more detail in each of these programs. So a brief update on our work in Japan. So the team was very busy over the past 10 to 12 months to continue advancing our partnership with Kyocera in Japan. So as a reminder, Kyocera has a life and environmental division, which manufactures various medical products, which include orthopedic joint implants. So for them, Progenza cell therapy products is highly complementary to their existing product range, and leveraging their distribution network is a real opportunity for Regeneus to monetize our asset in Japan. So we already earned 2 milestone payments. So out of a total $17.7 million, we already earned $4.7 million, and $13 million milestones are dependent on the achievements which you see here on the slide. So currently we are in the progress of setting up the manufacturing process of Progenza in Japan. So the next milestone payment of $3 million is expected later next year once the full manufacturing process is set up. Then subsequent to that, we will have 2 immediate milestone payments linked to recruiting 50% of the patients for the trial and 100% of the patients for the trial. So I guess it's important to emphasize that this $6 million in upcoming milestone payments are basically not dependent on the outcome of a trial. So our confidence level in getting those milestone payments is relatively high. And then the remaining $7 million in milestone payments are linked to filing a new drug application in Japan and getting the pricing from the national health insurance system in Japan. So you can see the timing associated with these milestones. So basically we expect to enter into the approval stage in late 24 or mid 24, sorry, and get an approval to commercialize the product in 2025. On top of upcoming $13 million in milestone payments, we also are entitled to single double-digit royalty rates, depending on the pricing of Progenza in Japan. Given our current work we do around the pricing of a product, it could be more likely that we'll be entitled to double-digit royalty rates in Japan. So both Kyocera and Regeneus team work quite closely together to set up a manufacturing process now, and we are well on track to generate and earn the next milestone payments associated with this contract. And both teams are very excited about the Progenza opportunity in Japan. So the second opportunity I mentioned to you is Progenza knee osteoarthritis phase 2 trial in the US. So as I mentioned, large unmet medical need in the US, 33 million patients in this market, or over half of them are symptomatic patients. So the way the interventional treatments market is set up, that there are over 7 million annual treatments in the market. So a majority of them are steroid injections, so around 4 million procedures annually, with a total market size of around 1 billion. Then there is a second line of treatment, hyaluronic acid, 2 million procedures, obviously at a higher price point, so also around 1 billion market size. And then there are various other treatments, which include opioids and PRP, BMAC, and other treatments. So in total, there are over 7 million treatments, and that's a real opportunity for Regeneus to enter with a Progenza long-lasting pain relief product and disease-modifying product and tap into this interventional treatments market in the US. So we've been very busy at Regeneus preparing for this trial. So we started the manufacturing of the master cell bank for the trial in the US. So this process is largely complete. The team was very busy in preparing all the information package for our pre-IND consultation with the FDA, expected to take place later this quarter. So we have a scheduled date for this meeting, and we initiated the manufacturing of the final investigational drug for this trial in the US. In addition, we're running an additional non-clinical study, which is partially funded by some of the grants in Australia, and we provide a disclosure in our partnership with Colling Institute, so to generate additional non-clinical data to support our regulatory filings in the US. So we expect to finalize the manufacturing process by the end of Q2 next year and file an IND in mid next year, and expect to start patient recruitment in calendar Q3 next year. With the recruitment and follow-up period ending at the end of 2023, on the basis of which we expect to have an end of phase 2 FDA meeting. After that, so we expect to run a phase 3 trial and initiate the BLA process with the FDA in early 2027. So the phase 2 trial will be a pivotal trial for us with 180 patients in 3 arms, so placebo and low dose and high dose. Primary endpoint being 12 months pain reduction, and secondary endpoints in knee function and stiffness, and disease-modifying endpoints, cartilage volume and thickness. Just very briefly, in terms of a positioning of our product in knee osteoarthritis care in the US. So one way to look at this market is from looking at the two axes. So one axis would be efficacy of the product, and second axis being a pricing of the product. So in terms of efficacy, there are various products with demonstrated data in, let's say, 3 months pain relief, 6 months pain relief. Only some of the companies, including Progenza, are working towards a 12-month pain relief, and there are only a few products which have a potential for disease modification on top of the short-term pain relief. And the pricing ranges, so for example, for commoditized steroid injections, the price point is somewhere around $250, but typically these products provide only very short-term pain relief of up to 3 months. There are a number of hyaluronic acid products which provide also mostly 3 months pain relief. Some of the companies are working on extended release hyaluronic acid products, which potentially have a potential for 6 months pain relief. 1 billion market segment for steroids, 1 billion market segment for hyaluronic acid products. Then there is more experimental therapies such as nerve ablation, bone marrow aspirate, PRP, and these products have also roughly 6 months pain relief data, again, without any disease modifying potential. And basically on the other end of a spectrum, there is a large segment of $26 billion of knee replacement surgery. So large orthopedic companies such as Stryker or Zimmer Biomet operate in the space. So where cell therapies sit into this market landscape is that companies like Regeneus with the Progenza product has an opportunity to demonstrate at 12 months pain reduction data, and on top of that also offer disease modifying endpoints, which will be highly competitive given the current treatments or treatments in development at the moment in injections. And also it has a potential to expand by taking a market share from knee replacement surgery. So basically, if we can provide a long-lasting pain reduction and stop cartilage degeneration, so that expands, so that delays the knee replacement surgeries, and this is a real market opportunity for our product, both from a volume perspective, but also from a pricing perspective, because Progenza will be well positioned to demand premiums to existing treatments on the basis of our 12-month pain reduction data and disease modification data. So moving on, so US is obviously a massive opportunity for us. US represents 65% of the global market share in by value in knee osteoarthritis, and we put a lot of focus internally to drive this preparation for phase 2 in the US market. So moving on, we are actively working with the Australian Department of Defence in preparing for a preclinical study in animal models for our Regeneus product, and potentially launch a first-in-human study in early next year. So this development program is funded by the Next Generation Technologies Fund in Australia. So Regeneus provides a real alternative to morphine, doesn't have addiction properties of morphine, and can be a very attractive product to treat certain pain indications. So we run this development with the Professor Mark Hutchinson from the University of Adelaide, with whom we've partnered already for a number of years. And importantly, Regeneus retains all the rights to the Regeneus IP as a result of this development project. So to summarize of why Regeneus is an attractive investment opportunity for you is that, well, firstly, we have a highly differentiated technology platform. Yes, there are a number of stem cell companies in the market. What separates us from the rest of these companies is that we actually have a proprietary technology around a combination of mesenchymal stem cells and their bioactive secretome, which has demonstrated superior therapeutic effect. We're going after pain and inflammation indications, and this technology is applicable in those indications. We have developed a scalable and cost-effective manufacturing process that enabling us to reduce the cost of goods of individual therapies. And we fully own the AP, so that's also an important aspect, because a number of companies rely on the AP from academic or research institutions or other commercial parties. And from our perspective, we don't have that risk associated by taking someone else's IP, so which we fully own and then have full protection in key geographies. Well, secondly, we go after very attractive market segments. So as I mentioned to you, a global pain management market is very large and growing, multi-billion-dollar opportunity. Our therapies have a disease-modifying potential, especially in knee osteoarthritis. So not many assets in the market can actually demonstrate that disease modification potential. So this is a real opportunity for us in osteoarthritis. And indications such as knee osteoarthritis have secular tailwinds. So aging population, increasing prevalence of obesity. So two key drivers in most of the developed markets will provide additional tailwind for us growing the total market opportunity for us. Thirdly, Progenza is a phase 2 ready asset. So as I mentioned to you, we have strong phase 1 data. We are setting up manufacturing processes, all manufacturing products already for phase 2 trials in the US and then Japan, and are well positioned to initiate phase 2 trials once the regulatory approvals are granted in those two key geographies. And having that phase 2 readiness, we're also well positioned to explore various collaboration licensing opportunities, specifically in the US market. And fourthly, Regeneus faces a short-term value accreting opportunities. So as I mentioned to you, we are entitled to additional $13 million in milestone payments from Kyocera, where $6 million out of that is we attach high confidence to these milestones, given that they're not dependent on the clinical trial itself or outcomes of that clinical trial. And obviously, we are on top of the Kyocera deal. We are exploring near-term opportunities for Progenza OA in the US, which is the trial which we expect to launch in 2022, and also running the first clinical trial for Regeneus in Australia early next year. So these near-term value accreting opportunities makes our investment in our company is highly attractive. So this concludes my presentation part, and you can find my contact details on this slide. Feel free to contact me directly in case you have any questions about our clinical development pipeline or other questions, and I'm happy to respond to you directly. So this concludes my presentation, and myself and Sinead and Charlotte, we are available to take your questions. Thank you very much.
Thanks very much, Karolis. We will now begin the Q&A portion of the session. Joining us is Regeneus Director of Clinical Development and Medical Affairs, Dr. Sinead Blaber, and Regeneus Head of Research and Development, Dr. Charlotte Morgan. A reminder that if you wish to ask a question, you can enter your question in the Q&A panel below. We'll kick off the Q&A session with some questions that have been pre-submitted by attendees ahead of the call. Our first question is, can you provide an update on your partnership with Kyocera? Are you pursuing other partnership opportunities currently? And if so, what companies are you targeting?
Sure. So I guess in the presentation I already provided an update on our collaboration project with Kyocera. Feel free to contact me directly if you have additional questions regarding that, but I think we provided sufficient level of detail. And now, given that both the teams are progressing well in establishing the manufacturing process and then subsequently launching the trial, on the back of the successful Kyocera partnership, we are definitely exploring other partnership and licensing opportunities. So for Progenza, knee osteoarthritis, all other markets outside Japan are available for partnering. So we have active discussions, mostly in the US, but also in certain other geographies such as Korea. We also have various discussions around our Regeneus platform, speaking to medical dermatology, pharma, and other companies. So there are discussions ongoing, and we will disclose the results of these discussions in due course once any of the agreements are signed with these licensing partners.
Thanks, Karolis. How will Regeneus's new research collaboration with the Kolling Institute support the Progenza clinical programs in Japan and the US?
Sinead, would you like to take this question?
Sure, thank you for the question. We have worked with Professor Christopher Little from the Raymond Purdy's Bone and Joint Research Labs for a number of years, so it's great to continue the collaboration with him. We're looking to do we are doing a preclinical study with him in a relevant osteoarthritis model. So this is a destabilization of the medial meniscus osteoarthritis model. And what we're looking to get from this is essentially to build on our data set for Progenza. So we're looking to confirm the pain relieving properties of Progenza, look at disease modification, and also the benefits of Progenza on immune response and inflammation. And basically all of that draws together to show the mechanism of action of Progenza and to build on our data sets that we're submitting to the regulatory bodies in both Japan and the US. The other really fantastic thing about this collaboration is that we were successful in the READY Fellowship Program, which is offered by MTP Connect. So we will be seconding Dr. Cindy Xu from Professor Little's lab. She has a lot of experience in osteoarthritis assays in the laboratory, as well as in osteoarthritis animal models. So she'll be coming across to Regeneus, and there'll be quite a symbiotic relationship there where we'll be able to tap into her expertise in the osteoarthritis space. But on the flip side, we'll also be able to expose Dr. Xu to a lot of the expertise within Regeneus, not only around the scientific side on mesenchymal stem cells and what they secrete, but also in the aspects of how you get a product from the bench into the clinic and then through to commercialization. So those are areas that Dr. Xu are really interested in across things like intellectual property, business development, clinical development, regulatory strategy, those sorts of things. And that's the real benefit of the READY program, is to be able to upskill researchers and at the same time for the companies to utilize the expertise of researchers in fields that are of interest to us. So we're really excited to welcome Dr. Xu to the Regeneus team and to see the results of this preclinical study with Professor Little and Dr. Xu.
Thanks, Sinead. Our next question, you indicated in the recent 4C that you have been working with regulatory consultants and global clinical research organization IQVIA ahead of your FDA pre-IND consultation. How confident are you with what has been submitted, and when do you expect to receive feedback from the FDA?
Yes, so, well, first of all, IQVIA is one of the global leading CROs. We retained their regulatory team to assist us in preparing a pre-IND, preparing us for the pre-IND process, going through this process, and then subsequently for the IND application. So the team was quite busy working over the past 5 months in preparing that meeting information package, which is a significant amount of work, kind of probably 600 pages or so document, which we submitted to the FDA, and we expect to have a meeting with the FDA later this quarter. I don't know, Sinead, Charlotte, would you like to comment anything on what do we expect from that consultation meeting with the FDA?
I can chime in a bit just to say that I think it was a really good process to go through, but also that we had a broad team from IQVIA with multidisciplinary experience and a lot of experience directly related to OA in their previous lives. So I feel like we had the best opportunity to put our best foot forward and to be really confident in what we're submitting to the US FDA the pre-IND. Plus, we were able to put questions not only focused on CMC, but we've brought it more into the clinical aspect and how we're designing and want to design the upcoming phase 2. So I think the confidence is high from the team in terms of the expected feedback.
Yeah, the only other thing I would add is, as Karolis mentioned, we do have a really solid data package behind Progenza in both preclinical and clinical, not only from a safety perspective, which is really important to the regulatory body, but also on the efficacy perspective that Karolis talked about. So actually having a product that has long-term pain relieving properties is a real advantage over other products that are currently in the market, but that disease modification piece that we've been able to demonstrate in both preclinical and clinical is a real advantage of our Progenza product that we're excited to put forward to the FDA. Of course, we're looking to confirm that in our phase 2 trial in larger numbers of patients. So we'll be looking to confirm safety and efficacy on patient-reported outcomes of pain, function and stiffness, but also on that disease modification side. So we're really interested to get that feedback from the FDA on both our data package, but also our plans going forward, as Charlotte just mentioned.
Thank you. Our next question is, you mentioned you are pursuing additional funding to initiate your Progenza US phase 2 study. When do you expect to provide an update on this, and how confident are you that you will secure this funding?
So we're definitely working on various potential funding opportunities for the phase 2 trial in the US. I guess, well, obviously we will disclose that in due course, but I guess one important comment here would be is that given our advancement of our partnership with Kyocera and much higher level of certainty around this project, it opens up also to various non-dilutive funding options, so asset backed financing options, so which gives us a lot of comfort that we will be able to have sufficient funds to run a phase 2 trial in the US. So unfortunately at this stage I cannot disclose anything more, but please follow the announcements from Regeneus, and I hope that in the near future we will be able to provide more information.
Thanks, Karolis. During your recent Regeneus in Action video series, Graham and Charlotte mentioned that no competitors are able to take the same approach as Regeneus's technology, using the combination of MSCs and secretions, as it is backed by a strong patent portfolio. Can you tell us more about how Regeneus's point of difference is maintained against competitors?
Sure. So in some of the presentations earlier this year, we provided a bit more detail on our competitive positioning, but I guess, Charlotte, you would be well positioned to respond to this question now.
So I think obviously the broad patent IP portfolio is key, but I think what we've got to really keep in mind is that we're not just an MSC only product with Progenza. The combination of the secretions or the bioactive secretome with the MSCs really gives us a competitive advantage. We've shown that in multiple in vitro assays where we've seen that the cells, when they're frozen with the secretome, on thawing, which essentially would happen directly before injection into a patient, we see a much higher immunosuppressive effect from those cells. So the cells can communicate and give action to the immune cells within that joint in a much quicker and more functional way because they've been frozen within the secretome. Not only that, so they give one effect into keeping the cells more functional, but also they have an effect on that by themselves. So we, again, in previous data that we've released, shown that we've got a high efficacy in terms of pain reduction with secretions without the cells as well. So in combination, the two are really powerful, and hence why we're going into phase 2 with the expectations to hit a disease modifying DMOD product, because We really feel that the cells that we're putting into the joint are going to be much more effective and much more functional than cells that have just been frozen without that secretum element. As Karolis mentioned earlier, we have other differentiators. I mean, we're not genetically modifying ourselves, so comparing us to iPSCs, you know, we are far in advance, both in our regulatory. We have phase 1 data that doesn't just focus on safety, but gives us that trend towards efficacy and sustained pain relief. So we essentially, you know, we haven't got the regulatory barriers that you would have with a genetically modified cell. We can draw on a long, you know, relatively long history of MSC safety to really get through those regulatory barriers that other potential competitors will have to overcome with the regulators in the future.
Great, thank you, Charlotte. Can you confirm when the phase 2 trial will be successfully completed in each of Japan, Australia, and United States for both Progenza and Regeneus?
So I guess I provided a timeline for each of these programs earlier in my presentation. So the timelines will be dependent on the final clinical trial protocol and when the regulatory approvals will be obtained, but our expected timeline for Progenza phase 2 in Japan is to start recruiting patients in Q1 2023. So basically that trial is expected to conclude in early to mid 2024. In the US, we expect to launch a trial in Q3 next year. So again, depending on how fast we'll be able to recruit patients for that trial, we would expect to have initial clinical trial readouts at the end of 2023. But again, refer to the individual slides for more details. And just to clarify, so for Regeneus, we're currently are doing a preclinical study, and we will initiate like first in human study in early next year. So it's not a phase 2, but phase 1 trial or equivalent.
Thanks, Karolis. Do you have absolute confidence in a positive outcome for both of Regeneus's platforms, Progenza and Regeneus?
Well, so in business, especially in biotechs, the term absolute confidence, I guess, does not exist. No one has a crystal ball. We do not operate in a risk-free environment. So obviously the team is very busy in preparing for each of those development programs and executing on them to maximize our chances of successful outcomes. Based on our preclinical and clinical data, we have strong reason to believe that our products are safe and efficacious, and it's a matter of running trials to demonstrate that and generate statistically significant data so that we get regulatory approval. So internally, obviously, we have a strong belief in our technology and the potential of this technology for various pain and inflammation indications, and it's a matter of execution now to get that clinical data and get approved and start selling products.
Thanks, Karolis. There has been a lot of activity in the stem cell industry recently. Is this the case for Regeneus as well? And how have you optimized your tech in the past 12 months? And how do you continue to remain ahead of the curve?
Charlotte, would you like to take this question?
Sure. Look, I think, you know, definitely within the last 12 months, we've been in a translational period. So the fact that we are getting ahead of the curve in terms of getting in front of 2 regulators, not just one, both with Kyocera driving to get in front of the PMDA in Japan, but also with this upcoming pre-IND feedback from the US FDA. So in preparation for that, we have been driving the technology to ensure that we build on what we created for phase 1 to make sure that it's, you know, we're going to achieve regulatory compliance with the technology and the design of the product. there are a lot of further requirements that are required between phase 1 and phase 2, and so it's really been that translational period to meet those requirements and put our best foot forward for the pre-IND package. Again, in parallel, Kyocera are moving forward as well and beginning to prepare for PMDA consultation, and we're committed to giving that technical guidance to ensure that their outcomes are as favourable as we hope that the FDA ones will be. In parallel, in preparation for the US phase 2, we've also been in a translational period of tech transferring, making master cell banks, and then preparing to make the investigational product. And so that really is a period of validation of what we manufactured and made for the phase 1, to then go forward and be able to tech transfer it to a reputable CDMO within the US. And so, so far that process has been very smooth and successful. And we're now ready, with some modifications post the pre-IND to go forward and have a good manufacturing practice or GMP process ready to go to make the product for the phase 2. So that's a considerable amount of effort and team support that's been needed to get to this stage. You just can't underestimate what it takes to get ready for the regulators.
Thanks so much, Charlotte. There are no further questions, so I will now hand back to Karolis Rosickas for closing remarks.
Thank you, Amy. So thank you very much, everybody, for attending this session. I hope it provides a bit more visibility on the activities and projects which we are pursuing at Regeneus in Japan, US, and Australia. So we are very much open in engaging with the investment community. So feel free to contact me directly if you have any further questions. Happy to respond to them, happy to have a call to discuss. And the team is very excited about all the opportunities we are pursuing, and we hope that in the near term we'll come back to the market with more positive news. In the meantime, please stay in touch with us, and yes, hope you will have great remaining of the year, and Merry Christmas to everybody whom I won't be able to speak before the end of the year. Thank you very much for your attention.